It's time for a real conversation about health. Hi, I'm Dr. Andy Michaud of Total Body Wellness Clinic, and each week on Restore the Real, I'll sit down with a guest to discuss how developing or overcoming health challenges has shaped the way that they live their lives, what they've learned, what they've changed, and how they're moving forward. Health is a deeply personal topic, and each person's experience is unique and significant, no matter the diagnosis. From clinicians to regular people to endurance athletes, you'll hear real stories from real people who aren't afraid to dig deep and share the incredible lessons and thought-provoking insights they've discovered while learning how to survive and even thrive under difficult circumstances. Welcome to Restore the Real.
Okay.
Welcome to Restore the Real. Today you are in for a treat because we are going to talk about frequency. Albert Einstein is attributed to saying, future medicine will be the medicine of frequencies. And while the exact wording may vary slightly, the core idea revolves around the concept that everything is energy, and that understanding and influencing the frequencies of that energy could be key to future medical advancements. Some interpretations of this idea suggest that different states of health and disease may be associated with specific frequencies, and that manipulating these frequencies could lead to new forms of diagnosis and treatment. Today, we are going to be talking all about frequency and how frequencies are being used to promote health, to promote change within the body, and are bringing out some radical differences in people's lives. And so my guest today is Alicia Stewart. Alicia, welcome.
Thank you, Dr. Randy. Thank you for having me. I'm so grateful to be here. This is going to be great. Thank you.
Absolutely. So I met Alicia several years ago. She is a research chemist, worked for Cellcore, which is where I first met her. And then she got into the world of frequency and use of what's called the iMate. And we've had her on before. So she has been a guest on the podcast before, but many new things have come out and many new understandings of frequency and the impact that they're having. And so I wanted to have her back on because there's some exciting stuff that she's seeing, that we're seeing. And yeah. So Alicia, would you share with us, like, how did you go when you think of chemistry? Like, it's very physical. It's and science in general can be very specific on things. Obviously it is. And then this world of frequency seems separate, but there's really so much interconnection. Can you share how you kind of went from, or how your background in chemistry and science really helped you move into this space of frequency, of use of the iMate, and what was that transition like? What happened?
That's like such a great question. And as it's at the core of my passion in doing this work. I was raised very spiritual, always been that way, and also very interested in science. So I wanted to be a doctor, and I got my pre-med degree in biochemistry, and that was always the plan. And my senior year in college, I remember learning in some of my advanced physics classes when they're talking about the quantum field. I remember thinking, sounds a lot like prayer. And that really piqued my interest to understand that this is actually the same thing. The quantum field and prayer, we're talking about the same thing here. So I've been looking to work in that field ever since realizing that. My senior year in college, I decided not to go to medical school, opened a martial arts school instead, did that for 15 years, and then became very, very sick for about 15 years. Lupus, Lyme disease, Hashimoto's. I was very sick, still wanting to get back into this work that I just had a vague concept of, the space where science and spirituality converge, looking to work in that space. So work as a research scientist, yes, a chemist. And what I also evolved to understand is that all those physical components are on top of frequency. Frequency presents first and matter arranges around it. So that's kind of where it comes together. And we're just talking basic physics principles here. So when we talk about frequency, it always is present when there's changes in matter. So we can attempt to change the matter, and sometimes that also changes the frequency, but not always. That's why cancer comes back. That's why things keep coming back, because the frequency is still present. So when we work on the frequency and the matter changes, that's lasting health. That's lasting change.
That's cool. And I love this quote that I've heard from my mentor and I've used, that where focus goes, energy flows. Right. And that focus is almost like is similar to the frequency. There's a focus that we have, and then energy flows towards that. And that energy can be, right, it is what it is. It can be positive, it can be negative, it can be beneficial, harmful, but energy is going to flow there. And then that's going to change stuff, right? It's going to impact what's going on within. It's going to influence the meaning that we give things. It's going to influence how our cells are functioning or not functioning. And so frequency, I think people can give an interesting connotation to frequency, but it really is in and through all of us. It is this field, and we are walking, moving through it, sometimes unconscious of it, but those energy states have a huge impact. And I guess I'll just use this analogy as we get into this. Think of music. And how fast can music change your emotional state, right? A song can bring you back to an experience where maybe you're in the car driving, and now all of a sudden the song comes on and you get super excited and you're like, oh my gosh, I remember when the song first played and this was happening. I was with these people. And then the next song, you could go from that ecstatic to now you're in tears, remembering maybe the loss of a loved one or a breakup or something that happened, and that song was playing at that time. That's frequency, right? And so it's just fascinating.
You can even play music to plants.
Right.
And they'll wither if you're playing certain types of music. So think of the impact on us when thoughts are combined with emotions. That goes right to the epigenome and starts making changes. And that's what the placebo effect is. This is mainstream medical. The placebo effect has to be included in every legitimate clinical trial, because it turns out a significant portion of the time, the frequency of the effect is actually what's doing the change. And that's fascinating to me.
Yeah. And would you say that before we dive into this biofeedback, would you say that even supplements, our food, where our food's produced, how it's produced, the state of those animals, plants, prior to harvesting, that frequency gets imprinted in there, and that impacts us, right?
100%. Glyphosate has a frequency, and it's a low vibrational frequency, and that affects us. Things like that. Of course, the state of an animal when it's being, prepared to be eaten, of course, that's going to affect the energetic state of the food that we're eating. What we listen to and what we eat highly impacts the state of our body.
Yeah. So again, the reason that I bring that up is, and that we're diving into this, is that, again, frequency is everywhere, right? It's not this abstract thing that, well, does it or does it not exist? No, frequency is in and through everything and is highly impacting us. And I love that quote from Albert Einstein, right? The future of medicine is frequency, and what is going to change that? And so I remember meeting you in the lab at Cellcore, right? And you weren't doing so hot, and things were challenging, and we were doing muscle testing and trying to help, using supplements, which there's definitely a benefit there. But then I remember things shifted like dramatically, and then you shared like, well, hey, I want to share with you what, has really changed things. Dive into that for us, because this is really fascinating. And you had done a lot of stuff. You had been worked on by some incredible doctors. Were taking some supplements that were targeted towards what was happening in the body, and yet there was still some challenges.
Whew, oh boy, do I remember that. And what a stuck point I was at, despite being at a lab that was, I would say, on the forefront of biohacking technology and having incredible doctors around me helping me. But I was still kind of going down in flames. And I wasn't even able to go through the protocol, the Cellcore protocol. I reached a roadblock where I couldn't even take the most mild supplements. My body was just rejecting, reacting. I was going in and out of anaphylactic shock, in and out of the hospital, was in pretty severe condition. And Dr. Watts, who was my boss at the time, had me training Dr. Carolyn Flannery on a separate device that she was learning how to use. And one of the episodes started to happen over Zoom. My face would blow up literally like this big rash. And she said, "What's happening to your face?" And I said, "Oh, it's happening." And that was the point where I had to go to the hospital, get there before my eyes swelled shut, text my mom, come get me. She says, "Okay, let's stop this training. I want to iMate you." And I'm like, "What's the iMate?" So she pulled me up and calibrated to me, and the swelling drained from my face in about 45 minutes. And I was fascinated. So I had to learn more. So she said, "Okay," at this point, it was like 10 o'clock at night. She said, "Okay, what's one more thing I can help you with?" And I told her, insomnia I've struggled with since I was a teenager. It's a severe problem. I get a few hours of sleep a night. She said, "Okay, get your PJs on, brush your teeth, get in bed." I just met this lady. I'm like, okay, she's either crazy or she's brilliant. I'm willing to try anything at this point because being a research scientist, I really couldn't find the answer and was starting to be a little bit scared about that. So I put on my PJs, got in bed, brushed my teeth. I didn't even drink my sleepy time tea, no L-theanine, no GABA. I'm like, she knocked me out. Like I woke up at 6 in the morning and I knew there was something profoundly different about this device. I've experienced lots of devices which are beneficial, but something here was different. So I obviously got my own, dug myself out of lupus, Lyme disease, Hashimoto's, in recovery from all three now, and then started using it in my research. And it just became overwhelmingly obvious that I needed to bring it to you. I needed to bring it to Dr. Watts. And it's just become a part of this. What I do full time now is iMate people.
That's fascinating. Okay, so before we go on, we've used this term iMate, and people may be like, okay, what's an iMate? Like, what is that? Can you describe, like, what is it?
Yeah, it's a bioenergetic device that works in the scalar field. And when we're talking about frequency, that can be kind of an abstract term. And sometimes it helps to just talk about just wave technology. This is just wave technology. So let's talk about another form of wave technology that we use every single day. And we don't really know how it works, but we know that it works. I can call your phone and we can have a conversation because I know your phone number. And so that's wave technology. Radio waves, are responsible for that kind of communication. Well, scalar wave is just a different type of wave. And DNA actually acts as an antenna generating and receiving scalar wave. And that's how the cells communicate, is through scalar wave. So the iMate is a scalar wave detector and emitter. So it's a device created by Dr. Straley that can directly communicate with our DNA through scalar wave. So we are exposed to lots of type of scalar wave, different wave technology, phones, the sun, you can feel the sun is hot, and infrared sauna. This is just a different type of wave technology that's specific to how the cells communicate.
That's really cool, and I love the way that you share that. That to make a phone call to somebody, you have to know their phone number, right? You can't just dial a random number and hope to reach the person that you are trying to get to. You have to know their phone number, and that's the same thing with the iMate, right? You need to know a little bit of information about that person, right?
Exactly.
To help kind of dial in, and then what's next? I mean, I would love to a little bit to take someone through. Again, you're listening to this, so it can be a little bit more abstract, but take us through, what are you looking for when you're in the iMate? So you've got them up, it's got panels on there,
Mhm.
and what are you now doing?
So I love that you use that term. I'm going to use it from now on, if you don't mind, dialing into someone, because
Yeah,
that's what
great.
we do first, right? And this can be described also as muscle testing software. So that's why if you would muscle test me that my name is Bob, my nervous system would test poor for that. So there are a handful of unshakable truths that everyone has: their name, where they were born, where they live. And if you have enough of those pieces of information, every person has like a honing beacon on top of their head with those unshakable truths. And so that's basically the phone number. So we give it the number of a person, the frequency. It then calibrates to that person as if we've just picked up the phone on either end. And the iMate has picked up the phone, and so has the DNA and cellular communication. And now we can essentially do what you are gifted at: muscle testing a variety of things. So what we do with the iMate is we let the body guide us. We do what are called bioscans in different areas to see, okay, what's coming up flagged. And what's happening is that the iMate has programmed into it. This is what took Dr. Straley 10 years to develop. It has programmed into it the healthy frequency of over 8,000 things. So the healthy frequency of a kidney is a known frequency. So basically, the iMate is checking, is there a healthy frequency of kidney here? It's like it's asking, is there a healthy frequency of kidney here? And the body's responding, not so much. And it's a little more complex than that, but it will give a range, like 50% of the kidney function seems to be working. So we can go into the iMate for lots of things. I usually go in to help people with chronic conditions. So we're looking for beyond root cause, which is what the iMate does. We've gotten really good at the what, especially in functional medicine. We can identify the what, and people really want to know, what is wrong with me? What is it called? Well, we can do that, but what the iMate does is it's looking for what's underneath the root cause, and that's the why. Which genes aren't functioning? Where is their communication lost in the body? And then it can provide the harmonizing frequency to upregulate kidneys, genes. It can find high pathogen load and provide the harmonizing frequency that will bring that load down. So we're looking for what's underlying and holding people back in their health, doing it that way.
And it's really fascinating because, and I love that you say that. With testing, we can often identify what's going on, right? And in some cases, we can identify, why that's happening. In some cases, right, if you're running the right things, muscle testing can help with that. But there's a limitation in that we're using physical matter to try to correct things, right? And sometimes the body does not respond to that physical matter, i.e. like supplements, or maybe someone's food list has gone from super wide to now it's like 3 foods that they can eat. Mm-hmm. And so healing with food isn't happening. And there can be other conditions that just are inhibiting their body from healing. I remember what I found with the iMate is it was with my shoulder. I don't know if you remember this. Maybe you do.
Yeah.
But you had shared with me about the iMate and what you were doing with people, how it was helping, how it helped you. And I thought, wow, that's pretty cool. And I remember injuring my shoulder, re-injuring it, playing volleyball. And I said, hey, can you work on me? Can you identify some stuff? And you did, right? I gave you specific muscles. I gave you areas where it was in pain, but there were a couple other things that came up. Glyphosate. I don't remember if infection came up or not, or like parasite stuff. But then you said, yeah, I'll put all this in the treatment basket, and then we'll harmonize this. So I want to come back. What does that mean when you harmonize it? But in this instance, I would say over a matter of hours, I'm like, wow, what's going on with my shoulder? And granted, I'm at my house, right? Just finished playing volleyball. I have no idea where, maybe at your office at the time or at your house, wherever. And I'm like, man, my shoulder, like it's changing. It feels like something is happening within. I'm like, no, it couldn't be this quick. That's not possible. And I think I either text you or called and I said, hey, I'm noticing some stuff improvement. can you run it again tomorrow? And you did, and there was definite improvement. Inflammation went down, range of motion increased, and I was like, dude, this thing's freaking awesome. This is amazing.
Mhm.
Um, so so in that time, and this is where I feel like some people get stuck, or at least I get stuck with people, is when we talk about the what and the why. Like, you found things on me, definite things in my shoulder, maybe some parasite stuff, some glyphosate, and then you said, okay, I'm going to harmonize it. And at first I'm like, what do you mean? Like, what are you doing, or what's happening? And this is where that DNA connection component comes into play, right?
Mhm. Absolutely. So harmonizing is basically reminding the immune system what balanced levels are on all these things. What's happening to most people who have chronic conditions is that the immune system is just it's busy doing a whole bunch of things that we're not aware of. There are lots of hidden allergies, and so it's spread really thin. So when we're talking about harmonizing, there's a couple of different components here. If we're talking about we find a high pathogen load, we're reminding the immune system. We're basically pointing out, hey, these guys over here need to be worked on, and so that's harmonization of pathogens. But if we're talking about something that belongs in the body, like connective tissue or enzymes, the frequency of an enzyme, the frequency of muscle, of inflammation can be elevated or it can be tanked. And if it's tanked, there's no energy in that area. There's no ATP. There's no electrical signaling in that area. Or if it's overactive, it can mean there's way too much going on. There's too much electrical signal, and so we're providing the frequency of a healthy enzyme or gene or kidney, kind of reminding the body this is what the healthy frequency is, and then the immune system says, okay, we do remember this, and it brings things back into level. So energy meridians, emotions, and we've all experienced this non-IM8 related when somehow either through prayer or meditation we're able to harmonize an emotion. We're in an extremely angry rage state and we find a way to harmonize that, which means to bring it into balance is really what that means.
That's really cool. Yesterday, I mean, this was yesterday. Um, a lot of things going on with me, and direction of certain things. And my wife came upstairs, and I hadn't said anything, right? I was working. I'm not seeing patients like this week. So I was just working on stuff. And she said, I think you need a hug. And I'm like, oh my gosh, you have no idea, like,
Oh.
how I just wanted your hand on my shoulder. Didn't say anything, right? It would have been so easy to say, hey, can I just have, I didn't, right? It's sometimes it's challenging to do that. And I'm not going to digress and go down that pathway, but that transference of energy, right? And one, even before that transference of energy, how she knew that that was needed. There was nothing spoken, but there was an energy transferred that she picked up on, acted on it, and then came up, gave me a hug, and said, hey, you may want to go outside and do some grounding. And I thought, yeah, I'll get to that. And then it was like, no, go do that. And it just calmed me. And so as I look at that hug, that energetic exchange, the earth giving me a hug essentially through grounding, it was improving my body's ability to communicate, right? It
That's
was
really cool.
sharing with my body the energy needed to turn certain things on or turn certain things off that were necessary. And though it didn't change the circumstances, it did make it so, man, my day was much better. I felt lighter. I felt more energetic. And um, again, external circumstances didn't change, but my capacity to handle those and work through those and then get to work with clarity was amazing. And it was shocking. And so as I look at the IM8, it's honing in on these, from what I hear you saying, it's honing in on these areas in the body that are distressed, that are overburdened, overtaxed, not enough input coming in, and it helps to provide what is necessary so that the body can make the changes and begin that healing state. Is that right? Is that a good way to say that?
100%. And I love that you bring up that story because basically your wife was functioning as a detector. We're emitting emotions. We know that. This seems like a physical barrier, but it isn't. We're shedding all kinds of things, cellular, physical components, but emotions as well. And she's a detector for the emotions you were feeling, even though you didn't have to say anything. Back to the science of this, which I always love to go back to the science. There is that scientist from the 80s, and I'm blanking her name right now, but she did all these studies on people that were in love, couples in love, and strangers. And she would do EEG brainwave analysis, and the heartbeat of someone that loves you is detectable in an EEG brainwave scan. That's mind blowing. But in people who are strangers, that doesn't happen. So when we say love heals, I don't think we even realize we can be in each other's physiology and provide harmonization. The iMate, I believe, is bridging the gap for the next wave of frequency medicine. We won't need the iMate 100 years from now. We have the capacity to do this for ourselves and each other. This is just opening the door for us to be able to do that.
Yeah. When you're working with people, do you need to take a history on them? Do you have to point the iMate in a certain direction, or is it? And clearly, there's clinical experience to kind of know, hey, I may want to go here or there, but is that required with the iMate? Do you need to know a history on that person, or can you just start pulling things up and identify, hey, these might be some challenges. What do you experience?
And I prefer to go in blind. I prefer to do that
Really?
because
Okay.
it helps create, of course people do come to me with specific conditions they want help with, but I actually try to get as little information as possible for the first session because I want to go in blind and see what the iMate is putting to the surface. Because again, we can be focused on this what or that what, but if I go in without that information, I don't have any preconceived notions about what I'm looking at. And it also helps create belief for people when I then present, here's what the iMate showed. And every time people are like, that's exactly what's going on with me. This condition, Hashimoto's, which is what they want to work on, we can now see how this foundational stuff needs to be addressed first. And then yes, I usually do an intake now after the first session. And again, I try to go in with as little of my preconceived notions as possible because I'm learning the body's more complex every week, and we need to let the intelligence of the body guide this process.
I love that you say that. I feel like we don't let that shine through enough. That we have our agenda, we have what we want to happen, and that can skew things, right? With any kind of treatment, if we have a certain lens, if we only see Lyme disease, or if we only see parasites, or if we only see trauma, then that's all we're focused on. And I remember listening to one podcast, and the guy that was interviewing said, if all you have is a hammer, everything looks like a nail. And I was kind of like shocked that he said that to the person. But at the same time, it's true. And so I love that what you just shared, that you kind of go in blind, because frequency in the field, it doesn't lie, right? It's going to pick up what's there. And sometimes I find that it may be a little like, okay, I don't understand this. Did it get it wrong? But it is like having that, nope, okay, this is what came up, so let's work on that. And it can be pretty remarkable what changes. So with that, if we shift to, you've been now doing the iMate for a number of years, and very, very specifically the past year, solo focused on the iMate.
Mm.
Um, what are some of the really cool things that you've seen clinically and research wise?
I love that you brought up, that sometimes things can come up in the iMate that we're like, how that doesn't seem like it's accurate. And I'm way beyond like needing to have faith in the software by now. I would call it, it's knowledge, because there's always a reason, like finding alcohol coming up high in children or sober people, at first seemed like this is something might be wrong here. Then finding some people do have a little bit of auto brewery going on. Even children can have dysbiosis to the point where there is a little bit of fermentation going on. So it's always being pointed out for a reason. And a big example of this is I worked with a woman last summer who was recovering from colorectal cancer. They removed a large portion of her colon and a tumor, and she was in recovery from that and kind of wanted me to kind of check on her and help her recover. So as I'm working with her, we're working on some post-op panels and upregulating her physiology and constantly checking cancer markers. She was very concerned about that. Never saw any cancer ramping up. I did start to see a lot of infection ramping up and physiological dysfunction in her spleen and upper GI tract area. And she had pain in that area and was told that the cancer is coming back. And she was very fearful of that. I kept working on her. And post-op, there's a place where you can do a scan where it's putting to the surface chronic things that need to be worked on and acute situations also. And the post-op panel kept coming up there. I've worked on lots of people pre and post surgery. The post-op stuff comes up for a week, maybe 2 weeks, but months down the road, I'm seeing what looks like an abscess near her spleen and post-op, like she's not recovering from the surgery. So this was one of the most terrifying, it is the most terrifying iMate moment and situation for myself, because I finally recommended to her, I think they need to open you up again. Something happened during that surgery.
That's crazy.
And I was shaking. I was terrified because I knew she would do it. And so she got a CT scan and an MRI, and her doctor fought her on this situation a little bit, but she actually had to go see a different surgeon. Her surgeon wouldn't do it. She had to go see a different surgeon. And they opened her up, and I don't think I breathed the entire 6 hours she was under. And turns out she had a huge abscess on her spleen. They had to drain it. And her intestines, it looked like she was put back in a little twisted, and there seemed to be a nick in the area near the abscess. And so the new surgeon confirmed to her, it looks like there was an injury during your first surgery. And I breathed a huge sigh of relief. We both cried for quite some time, and she's fully recovered now, doing amazing. And that's a testament to not questioning, because her body was basically screaming out, help, we're not recovering. And so I listened to that, and I listened to the body more and more now, the iMate more now because of that situation. So I don't question what comes up now. That was a big case.
I mean, that's totally life-saving. I mean, you look at when they're telling her that it's the cancer is coming back. I mean, the treatment would have been all wrong, right? And they're using their best intellect in terms of what they know, but I mean, you wouldn't know that. You couldn't identify that in another way.
Really injured her
anymore. How incredible is that? That's amazing.
It's a good one.
Yeah, that's fascinating. What are some other things that you've seen? I know that you do, and we didn't really talk about this before we went on the podcast, so I hope I'm not putting you on the spot. But in the clinic, we use the Minela, right, which is like a full body scan, and it helps identify, I think, 128 different points in the body, from things like regular like blood labs to lymphatics to autonomic nervous system, body composition. So it really puts a great reading on the body. We're not talking about that, but you've done these and then done a series of treatments on the iMate and then rescanned.
Mm-hmm.
And what do you find? Do you see things improving from that standpoint as well?
It's a really good question. And you know me and my research scientist mind, I had to vet this right away. So after I got mine and started working on myself, in that first couple weeks, I needed to see what is this doing? Is it all placebo effect? Is it just my belief factor that's doing this? So I happened to work at an incredible lab at the time, and I had access to all this really cool scientific equipment. I'm certified in QEEG brainwave analysis. So I was like a kid in a candy store, had the Menla as well, scanning people on the Menla, doing very basic 5-6 minute treatments and post scanning on the Menla, showing massive changes in the autonomic nervous system. Even something fluid balance can change. This person's sitting on the couch for they're not drinking water, they're not going outside, they're just sitting there. Massive changes in energy meridians, lymphatics can drain, sodium potassium pump inflammatory markers. And so I wanted to see with the Menla first. And then, of course, I put the brain cap on many people. And I have the data for this. I'm happy to, I should have had it ready for this call, but you can put the brain cap on someone and get, an EEG brainwave analysis, and you can see the parts of their brain where there's deviant brainwaves, do an IMATE treatment and restore those pathways. That was the tipping moment for me where I was like, I'm in. This is irrefutable scientific data. This just provided what, a neurofeedback session, would provide in a very powerful way. So I had to see right off the bat. And live blood cell analysis, also pre and post, definite changes. So it absolutely is changing the physiology. And we know scientifically that's how this works. You change the frequency, matter ranges around it. And apparently it's actually a lot easier than we realize.
Yeah. And I remember you showing me some of those QEEGs, which was fascinating, right? Some with my own family members, some with others, people that you were working on. And it was fascinating to see the before and after, the new or the improved connections or the calming down of the brain, so that there was more, clarity, more healing taking place, getting more in that parasympathetic state of healing, of resting, digesting, recovery, as opposed to being in this massive state of fight, flight, freeze, fawn, that sympathetic dominance. So that was fascinating. And it was always cool to see how excited you were to say, oh my gosh, you got to look at this. Because it was just more of that like belief factor of, wow, this is not just placebo. This is really changing things from the inside.
It is.
Can this be, okay, 2 questions. One, do you have to be in person to do the scan?
No, this is a virtual system. There is an upgraded ability to treat someone in person with a head harness that provides a little bit of electromagnetic support also. But the scalar wave technology and the software can be done anywhere. That's how quantum physics works. So you could be on the moon, or you could be in Europe, you could be next door. The quantum field, there's no distance really in the quantum field. So wherever your physiology is, we can calibrate to and provide just as effective treatment if you're sitting in my office or if you're in Italy.
That's so cool. And it's such a benefit that people can receive the benefit of this, like wherever. That's awesome.
Game changer.
My other question is, can this be paired with other treatments? Would this be a standalone thing? Or if someone was being worked on via IMATE, would you also have them working with a practitioner, doing supplements, or working on those things?
Absolutely. The supportive therapies will really help speed up someone's progress in their healing journey. And all these modalities are wonderful. Rife Machine, PEMF mats, Flowpresso, working with a practitioner, absolutely. That will really help unleash the physiology faster and help guide the treatments. This is like precision therapy. You can see in the moment what someone's nutrient panel looks like, not 30 days ago, but today, now, where someone's B12 at. And then you can check it in a week or so instead of, well, here's your supplement. Let's hope that it's working. Let's get eyes on it live. Hormones. Testing for hormones is so complicated. And I'm seeing sometimes what's coming up in blood work is opposite of what the IMate is pulling, and that's because the blood is showing what's being transported and excreted. So it really helps empower a practitioner to know, wait, this therapy is great for you, or even something as simple as cold plunging, not good for this person because they're in fight or flight. And in women, it's a much more complicated situation, and so it really empowers practitioners to do precision therapy for their patients and clients. It's very supportive.
That's cool. And I asked that question knowing full well that it works very well because we're working together
Yes.
on a client, right?
Yeah.
Um, Not to share too much, but this young gal has 8 autoimmune diseases under the age of, we'll just say under the age of 20. 8 autoimmune, 8, right? She's not a 40-year-old, not a 70-year-old. She's young, and 8 autoimmunities. And we started working together on her really from the onset because I had told the family, yeah, this is how I want to set this up, that I'm doing things and that you are also supporting, because there are things that I can't see and that we're going to need to make this work. We need frequency, we need support. And so you started working on her, but then recently she came into the office, and this is always so fun to see how this collaboration works. And yeah, I'll kind of let you, like, what do we do in that session? She was here. She travels from out of state. She
Mhm.
comes here, and I was about to work on her, start to do some muscle testing, and I thought, wait, let's just walk into your office. You're here in the office now, and let's just do this together.
Mhm.
So, kind of paint that picture. What did we do?
It's quite magical, to be honest. And I remember the very first time we did this. You had me come into the front room. I don't remember who it was with, but basically, you were muscle testing, and I've worked with you enough now to, and we're both so involved with Cellcore and protocols, but I've worked with you enough and, you know, watched you work with patients enough to kind of know where you're going to track with your muscle testing. So I, side by side, am also kind of testing those same things. And the very first time I did this, I was just really blown away, because you're testing glyphosate. I'm as well, boom, 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 markers finding the exact same things, you know, at the same time, or you tested something that I had just tested it like a minute ago. We're going to the same, and it validated, um, not only the IMate, but your ability is next level. And you are absolutely finding the what the body is wanting to bring to the surface. It just really made me understand how gifted and skilled you are, and also how valid the IMate is, because we're finding exactly the same things. And then it can also maybe help guide you into another place, because of all the things to test in the body, whew, I mean, I don't think one brain could ever contain all that information. So,
No.
some random things can come up from time to time, and then you can get in and muscle test even deeper for that. So it's quite a magical collaboration, and it's why I believe every practitioner should own one or have someone that works with them.
And it's been very validating for me as well when I'm testing to see that, hey, you know, the frequency is showing the same stuff. So it's like, okay, I'm on the right track. We're both seeing the same things. And then, recognizing, yeah, this is the right time or the wrong time to add a supplement or not to the body. But knowing that we can work on it with frequency. So what was cool with this girl is, experiencing more pain, more things in the joints, specifically her hands and her knees. And it's like, oh, that sounds like Lyme to me. And it was cool because I'm like, hey, will you test Lyme, Bartonella, Babesia? And, and I think I had tested one of them and the other two didn't come up. And you're like, hey, I'm not seeing this in the IMate, but I'm seeing this. And again, we were tracking on the same thing. And then what's so fascinating with this is when I then bring up, okay, what are we going to use to treat? She wasn't ready for any of the herbs, right? Way too strong and way too early in this process to start trying to kill stuff in a system where so much is compromised. And many medications, and we don't want the interaction of these herbs with some of the medications. So it was like, hey, I'm going to hand this off to you. I'd like you to work on these, list of things, some parasites here, some Lyme, frequencies to help support her body, because I can't go there yet. And it's so, it's very empowering to know that you're not like, okay, well, we can't do anything about this yet. Or, well, we'll just give some supportive treatment, which may or may not really be beneficial, but to know that, hey, no, we have this here that's working behind the scenes,
Mm-hmm.
and that is so beneficial and powerful at the same time.
Mm-hmm. And she's
And what
having
we
some tremendous
and,
results. Mm-hmm.
right. And so they let us know about sleep. Like, tell us what they found. Tell us about that. That was fascinating when you told me. So you have to know that this young girl, when she tries to go to sleep at night, it's like worst time of the day, right? How many of you have experienced that, where the day's been pretty good, you lay down, and instantly either your body goes haywire. It's like you've just been plugged into an electrical outlet, and your body is just like just getting pummeled with stuff. Sometimes it's the mind that's going crazy and you're ruminating on stuff and it's spinning and it feels like your heart's going to be out of your chest. Other times it can be intense, severe pain in the body. The legs can be jumping, restless leg, vibration in the body. And it's like, what the heck? All I did was lay down in bed, and now my body's going crazy. And so you wanted to work with her in that moment. And yeah, what was that experience?
So I'm working on her, yes, like as she's getting into bed and going to sleep, because that's when this starts to ramp up. And I'm glad that you brought up emotions, because of course that can be driving something like this happening. And with her, um, she's a powerhouse. She's a spiritual, emotional powerhouse.
Totally.
And are you there?
Yep.
Okay. Emotions wasn't the thing with her. With her, because of everything she's been through, even from birth and the onslaught to her physiology, the trauma of all the surgeries she's been through and the therapies she's been through, her immune system is in a strange spot where it's busy doing so many things, it just can't calm down. So first checked her emotions, and her emotions are on point. She's not ruminating in any negative frequency, and I was glad to kind of take that off the table. And so then I went right for, again, not going in with any preconceived notions, because that's the trouble we've gotten into, is trying to do the job of the immune system. So going in very gentle with her and just finding what things is the immune system busy doing so that it can't do the other things. Very basic, a couple food allergies, a couple airborne allergies, a couple toxins, very small treatments on her. And within the first few sessions, she started adding sleep time to both the night and the morning. I mean, she before they couldn't get her to sleep till 3 a.m. She was up by 7, and restless sleep in there. All of a sudden, she started going to bed, falling asleep a little earlier, and sleeping a little later and later. And that was happening per session. And what I am doing is very mild and basic. I'm not even working on restless legs specifically, because that may just be the word we're giving it. I'm just letting the immune system put to the top what the iMate can harmonize so that it can do the other stuff.
It's so fascinating how powerful this is, how this works, and the benefit that it has to the body.
Mm-hmm.
And again, as you said, like, your belief is that, hey, every practitioner needs one of these, and that we need this in the hands of people, because it's medicine is interesting, right? We give a lot of that power away because it is complex, and for many people, it's not their job. Their job isn't to go in and research, and there hasn't been schooling. There's not a understanding of biochemistry. And so it's like, I don't know what to do. I just am kind of at the whim of the doctor or the healthcare provider or whoever to provide treatment. And is it working or not? We hope it is. Um, but I've heard you say, and I've heard Dr. Flannery say, like, everybody needs like an iMate.
Yeah,
And there's probably some truth to that. Um, and if not having one, then having the ability to utilize that in part of what you're doing, right?
absolutely. I think we've in medicine, we've forgotten the most powerful, knowledgeable practitioner that we all have access to, and that's our own immune system.
Yeah.
Our own immune system, our innate protective mechanism, is the most powerful source that we have. And so that's what the iMate is communicating directly with that.
Yeah. So powerful.
Mhm.
I loved the conversation, and I think that we very succinctly and actually very eloquently shared what frequency is and how is this impacting the body and how this could be beneficial to really any treatment that you may be doing. Right? It's not. It's very congruent again with your body. Um, you recently did a webinar and wanted to give access to that to people. Um, and I guess with that, where in closing, let me say this in closing, I've found that this has been highly beneficial, right, to myself, my family, my son, who we didn't even go into that, but I really think that he began to grow at the age of 2 as a result of work with the iMate. Like he was not thriving at all and was not talking. We're not even talking really like mom, dad, at age of 2, like there was nothing. There was no sentences and kind of a little worrisome, but at the same time, it's like, what are we going to do? So I do remember, and I guess I will go into this a little bit. Um, we were working with Dr. Flannery at the time, who you had mentioned, and doing certain treatments. I honestly forgot what we were even working on. Honestly, I don't remember. It was 3 years ago now. But I do remember that I was sitting in our loft and Caleb and my wife walked by. It was still dark. It was probably winter. And Caleb looked up and said, "Is that dad?" And I'm like, he just spoke. Like he actually said a sentence. Like this was groundbreaking. He had not had any signs of speaking. And it was like, yeah, it's dad. Like I was blown away. It was so cool.
Didn't it have
And
something to do with his hearing, that there was some inflammation in his ear that he couldn't quite hear well? There's
there
something with
was there was inflammation all throughout his body. He was a COVID baby in the NICU, stopped breathing at 7 minutes old, whisked away to a different hospital, and we had to come follow. So there was a lot of trauma in his life in the beginning, um, and a lot more behind the scenes that was going on as well. And he just was not. He wasn't thriving. Right? There was a lot of stuff. I would say yes, there was some stuff with his ears, but there was so much emotion in this kid that the body was not processing well, and so again, he wasn't processing and wasn't growing, and the iMate really the frequency that was used, the things that were harmonized, the things that were addressed, um, helped his little body to begin to thrive,
Mhm.
and then he just became this little chatterbox of activity and talking. And it was like, hey, we think he's growing, which was fascinating. And I think that's what really helped us see the benefit, the power that this has, and how much. I think for my wife, for Jen, she would ask me, hey, can you test this? Can you test that? Can you figure out what's going on with the kids? But now she has a way that she can tap into herself or the kids if there's a sniffle, a cold, whatever it might be, and say, hey, what's going on there? And harmonize these things so it doesn't become like full blown disaster. And it's been fascinating to use that and to see this kind of thing over and over again.
Amazing. Every mother should own one also, not just every practitioner. It's a gift when children can't tell you what's going on. You can take away a headache, or, family members. My dad was in full stroke mode at one point and you could calm that down. It's really a gift to be able to help our family members.
Yeah.
Yes.
And this isn't like a one-time thing, right? This is like any treatment. This is the frequency of it is going to be highly impactful, right?
Yes, absolutely. Yeah. And the more fluid something is, the faster it might resolve. Emotions, we can, just like body code, we can resolve those maybe in a session or two. Things that are more dense, like bones and genes and chronic conditions, yes, it will take some time, successive treatments, to resolve them. Yeah. It's possible.
Any final thoughts? And where can people find you?
I'm just grateful to be here, Dr. Randy. I love working with you. I love this space that we're in, the way we're able to help people and collaborate in science and spirituality and frequencies. I'm just very grateful to be here with you. And I can be found at imatenation.com. And Dr. Randy's going to include a link for a webinar that I just produced. It's a free webinar. You can register for it and watch it and get a lot more information about the iMate and what it can do. And thank you so much for letting me speak on it.
Absolutely. And thank you for sharing that with us. Thank you for sharing the knowledge, the insight, and just the passion that you have for healing and for people with us today.
Thank you, Dr. Randy. Thank you.
You're welcome. Blessings to you all. Be real, keep it real, and please share and share this with someone that you love, that you know that is struggling, because it can make a major impact and difference in their life. Blessings. If this episode stirred something in you, let's keep the conversation going. Whether you're navigating your own health journey or just feel like there's more to your healing than what you've been told, I'd love to connect. You can join me on my next webinar or book a free discovery call. Both are powerful ways to explore what's really going on beneath the surface. Check the show notes for details. I'm Dr. Randy, and this is about restoring what's real together.